Hello, I'm Santanu Mukherjee. I'm a speech language pathologist by profession. One of the most common questions I get from the parent of autistic children is about speech therapy and what to expect at home. Today, I'll be answering few of the most frequently asked questions so that I can help them in their very basic need. Now, the very first question what I get is, how do I know if my child with autism needs speech therapy and when should I start? First, we need to know what is speech therapy. Speech therapy is a scientific process to promote communication. Now, the point is, when we see if the child is already has been diagnosed with autism and we see there is a difference in their communication and in language for more than 6 months, obviously we can start speech therapy. If we want to talk about when to start, first we need to see the child and we have to measure his language, his or her language first, and then we have to act accordingly. And the next part is, when should I start? We can start as early as possible. Speech therapy can be very crucial in early intervention phase also. If you see at after 1.5 years of age, if your child do not comprehend simple instructions like give me the ball, give me a bottle of water, or cannot indicate basic body parts, and if they do not have a minimum expressive vocabulary for around 10 to 15 words, yes, that's a red flag for you that you should initiate or consult a speech language pathologist. What are some simple speech therapy activities I can do at home with my autistic toddler to improve communication? Toddler is mostly 1 to 3 and 3 to 4 years of age. So after speech therapy techniques, speech therapy approaches changes with age, changes with language capability, language status also. But very shortly, in a very general way, if I want to tell parents what to do, the very first point what I always emphasize is, do not force them to speak. If you always force them to speak, believe me, it is not going to work. We know that they have poor listening skill, hence they have poor auditory comprehension, and as they do not listen well, they do not understand what and how to use verbal language or verbal words in specific situations. See, the auditory comprehension or understanding of language is the key of success. I have seen lot of parents who are working on expressive language. The whole day they say their child, say this, say this, say this, I want to have drink, I want to have water, I want to have etc. etc. But the point is, if your child do not comprehend enough instruction, if they do not have enough social comprehension, believe me, they are not going to use any communication, especially verbal words. So my request to all the parents, you have to work on their auditory comprehension or understanding of language. By how? Let's select few instructions, 5 or 10 instructions start with, and try to use it at your home. If they are not able to comprehend it, just hold their hand, do it by yourself and praise them very well, so that he understands, okay, if my mother says bring me a bottle of water, I have to do like this. We all know about incidental learning. The more they become experienced, they will learn new things, they will learn new instruction. Now a child can understand one command in 2 days, sometimes a child can command after 20 days. That depends on the severity of the kid's problem. But the point is, you have to work on 2 basic points. Number 1, auditory comprehension increment, and number 2 is, you have to let them listen that what you should say in a specific situation. My child has a speech delay. How is therapy for autism different from therapy for children with general speech delay? I always believe, especially in autistic, in this area, the parents are the key person to work. Let's go for some other topic. They have lot of other issues, right? They have sensory issues. Now they are not able to cope up with their family members also sometimes. Though how come they will come to an unknown place and they will speak lot of words? You have to show him cards and ask what is this, what is that, and they will answer all the cards. This expectation is too much, right? So the first activity what we do in speech therapy sessions with, especially in autistic kids, is to improve their social skills and on demand activity that you have to let them understand. Say suppose you have to work for 10 minutes 2 or 3 times in a day. When your parents are working with you, you have to work with them. This is the very first point what we should teach them, what we should stimulate them to understand, that you have to work. And after that, in autistic cases, we have to go for more comprehension activity, as well as I told you, that approach is modeling approach, or we have to let them listen what to say. Now in normal cases, in other cases, when we demand something, they understand, they do not have that kind of social anxiety. They used to, after 1 or 2 days, they used to reciprocate with us. But in spectrum, they may take a long time to understand that why I am coming to this uncle and how he works. So here, parental home training program is very, very crucial in autistic kids. The parent have to understand how my speech therapists are working with the child and what he expects from us, because our child is not going to cooperate with him initially. So the point is, in autistic kids, the role of parents become more crucial, the home training program becomes more crucial, and as well as we have to work on social skill first instead of direct language and other speech issues. Now the fourth question: how can I keep my child engaged during speech therapy sessions at home when they struggle with focus or behavior? See, there are a lot of models, there are a lot of programs in the world to work with autistic kids. But from my past experiences, what I found, the threshold of every child's attention is different. You cannot force them to go for an unified amount of time session, like you have to work for 20 minutes or for 30 minutes at a stretch, however and whatever the conditions are. No, this is not. If your toddler, your child struggles to keep their focus, keep the therapy session very short. I have seen children where I say that you can work 20 times a day, but go for only 2 minutes. I used to say this: one work at a time. Means choose an activity, sit on the place where you are actually, and work with them, and let's leave them. Being a speech therapist, I always promote that fixation is not good for them for speech and language. Means you have to use that particular table and that particular chair to stimulate for the session, and then they will coordinate with you, then they will reciprocate, then they will behave properly with you in the session. Being a speech language pathologist, I do not like it. That's okay, that's good for special education and for other purpose. Tables are mostly to segregate their attention from other places. But what I find, speech and language sessions can be taken anywhere. It can be short enough for 1 to 2 minutes, means one work at a time, to up to 30 minutes, 45 minutes at a stretch in a very good condition. If your child struggle to keep their focus, my answer is, do not expose them with negative words. Do not expose them with their failure. What you have to do, hold their hand, do the job and praise them. Let them understand, okay, if I do like this, my mother becomes very happy with me. The basic purpose of these sessions are basically to stimulate them to understand that these are the sessions, these are the time when social demand is high from you and you have to deliver accordingly. Those sessions later a child understands, okay, these are the time when things comes out, when all the plays, toy materials, all the cards comes out and I have to work. Now the point is, if he doesn't allow you to work with him, your job is let them work very simple task. If they do not want to do, let them work by your own hand and finish the session, finish it in a good manner. Otherwise it will be a negative reinforcement for them that whenever is my mother or my father is working with me, it ends with shouting, hitting and any other negative activity. We do not want it literally. It doesn't help to build speech and language skills, believe me. Now what tools, techniques or daily routines really help autistic children improve speech and language skills? This is the next question. Very good question. Fixed daily routine obviously help them to understand their next step, as they do not have very good social adaptation ability. It will really help them to reduce their social anxiety, their other behavior. They can expect, okay, at 8 I am going to sit with my mother. Obviously this helps, but I say again, depends on the severity, the situation of the child and lot of other issues. The basic 2 techniques which I always advocate are basically AAC. AAC is alternative augmentative communication skills, and number 2 is modeling approach. Again, we have to select these 2 systems according to their severity, their adaptability, their social skills as well as home condition also. By AAC what we understand, yes, it's a non-verbal communication tool. Non-verbal communication, any non-verbal communication, see the magic word is communication. Any communication in autistic children is good communication. If a child uses non-verbal communication, that can be pointing, that can be gesture, that can be picture exchange, that can be any gadget, that can be any app, all are welcome. All are welcome. This will obviously help in verbal communication later. But still, being a speech language pathologist, my first point should be, yes, we have to work on their comprehension also. If the pure auditory comprehension we can achieve, nothing is good, better than that. Now, there is another technique, what I personally prefer is a combination of both. Here again, as per the severity and as per the status of the child, we have to plan accordingly. This program is called as modeling approach. Now, what is a modeling approach? It comes under indirect approach. Here, the parent has to be a model. They do not have to be teacher. The model, the way we used to learn in academics also, the way we used to learn things, those kind of techniques doesn't work here. Let's give you an example so that it becomes simple for you. See, suppose The child wants a toy which is above his height. He is not able to take it, and he is showing mother like this. He is showing communicative intentions. Okay. On that point of time, we have to be a model. We have to let them listen. Give me the toy. Give me the toy. Give me the toy. See my face, so that he understands, okay, they want me to say this. If they cannot repeat, it's okay, but still we want to stimulate. Give me, give me, give me. I am emphasizing on that word give. Means I am trying to put pressure on the verb, because verbs are the most important vocabulary of a child. If a child can use verbs, the purpose of communication will be served, because the purpose of communication is mostly functional communication. He wants to achieve or wants to manipulate a situation according to their need. So now we come again, we want to use those words. Give, and I will just take that toy and I will give it to him. And once he achieved that toy, he will smile. I will say again, thank you. I will say like this, thank you, so that he understands, okay, I have to say this word once I can achieve that toy, that thing, whatever I desire. So it's a very basic example of modeling approach. Another area where we can work, we all know in autistic children, they have a tachylalia, means very fast rate of speech, which often shows lots of phonological errors, mostly omissions. So if he says like this, give me a key, give me a key, give me a key. See, he is using words, but he is saying so fast, only his parent can understand that whatever they are saying. So the point is, if the parent can understand that my child is saying this, be very specific, emphasis on each and every phoneme, each and every sound. Give me biscuit. Give me biscuit. Here we have worked on the articulation or pronunciation of the child. Means we are trying to show them this is how you should articulate it when you want anything. So this is the next part where we are working on articulation. The last part, this is a very common questions what I get from parent. Sir, he says everything, but his voice is so mild. He has so feeble voice. Like whenever he is walking, a neighbor asks, where are you going? He is saying park, but he is saying like park. Often their parent has to say it loudly, then they say park. Now the point is, now they have got a kind of habit also, that they will say it first very slow, and after that once their parents say loudly, then only they will raise their voice. Yeah, they have confidence issues, they have social issues, lot of things are going on around their head. The point is, we cannot dictate them, we cannot teach them that see, you have to use your voice around 60 decibel loudness. We cannot say a child like this, right? Their volume meter, as they have poor social skills, the volume meter, that how loud I should be according to the situation, they are not able to understand it sometimes. So here again, my plan is what I always advocate. Whenever they say park, just say loudly park, so that they listen, okay, this is the volume I have to use during social conversation. Slowly, gradually, they will understand the volume. So these are the very few points. Now as a whole, what I have discussed this far, the last question is is around that. Beyond just words, how does speech therapy support social communication, listening, and overall development in autism? See, the role of a speech therapist is not to make your child speak. You have to understand this. The role of a speech language pathologist is to promote or to stimulate or to help you to learn the techniques what you are going to use with your child to communicate. Now, I have said earlier also, each and every child is different and their demands, their features, their behaviors are different. So, a speech language pathologist activity is to assess them first and accordingly plan techniques or stimulatory factors which are going to help your children. Obviously, with this kind of techniques what we have already talked about, that to improve auditory comprehension by improving lot of listening skills, pre-verbal skills, obviously it will help your child's social role, because if a child can understand things, mostly they speak. In my last 1 decade of journey, I have seen children who becomes non-verbal are due to 2 reasons. One, they have very poor listening skills, so that they are not able to comprehend verbal instruction at all. This can be a reason. And another point what I feel, they have severe developmental dyspraxia, that they are not able to understand that what is happening inside, as well as they have very high SPD, so that they are so submerged into their sensory processing issues that they are not able to follow how others are producing speech and language. So these are the 2 basic points. Now, if a child can comprehend, and after this using these modeling techniques, the overall growth of a child will be definitely will be beneficial for a child, because when a child understands verbal communication, their social adaptability becomes high. Let's give an example. There are 2 children who has some issues, speech and language issues. One children, he doesn't speak to anybody, but he can comprehend each and every command teacher used to give him. But he has social issues. He doesn't express his needs. He expresses only by pointing or by intentions. And there is another child who uses lot of communication. He can recite a poem, he says everything, he says lot of academic stuff, but he is not able to comprehend instruction properly. So what do you think? To whom the teacher can work easily? See, the answer is the first one. The first one understands his social comprehension will be high, so naturally his social adaptability will be high. The frequency of meltdown or any other behavioral problem will be lower. But in second case, where he speaks a lot but he doesn't understand, it will be very difficult for a teacher to let him understand how classroom activity, what is the classroom ethics, how it works, how is the social behavior. So coming to my previous point, so if a child is able to understand and can express, obviously their social skills will be improved. But once again, I have to give another reminder to parents that do not try to force your child to speak. The more you try to do it, the more they will be actually go away from you socially, because they will understand, whenever my parent come in front of me, they will ask me questions, and if they always ask, we do not love those teachers who always ask us questions, right? Who always examine us. We do not love those people. So the point is, being a parent, your primary job is to work on comprehension, to work on modeling approach, or according to the situation on AAC, and do not show your expectation and do not show your social anxiety that my child is not talking, so that they understand, okay, my parents are always demanding. So do not demand always. It will definitely help your child for a better to achieve a better social communication skill. So now I hope there are a lot of other things to say also, but I hope the questions, the frequently asked questions what I have answered will help a bit to those parents who have autistic kids. I want to thank India Autism Center for such a lovely initiative where we can express our knowledge, our thought. If it reaches to the parent, and a single parent stop forcing their child to speak, and if they can learn this kind of techniques, it will obviously help their child to gain social confidence, social comprehension skills, and their overall development.